Hi everyone. Welcome to First Friday, May edition. Well, we have a lot to talk about today because yesterday the House of Representatives passed their repeal and replace legislation for the replacement of the Affordable Care Act, which is otherwise known as Obamacare. And you know that I don't really use that term since it's not the official name and it's confusing. But so don't get too excited about this yet. I've had people text me and lots of questions about it, but don't get too excited yet because there's still a lot that has to be done before this is actually law. Now, I am not an expert in governmental procedure, not by a long shot. I did take civics in high school, but that's been a long time ago. But I do know this passed the House of Representatives, which means now that it goes over to the Senate, so it'll go through committee. And I'm sure there will be a lot of changes made when it goes through committee. And then it goes to the Senate for a vote. And then if it passes there, it goes to the president for his signature. And then it actually becomes law. So we've got a lot of steps between now and then. It is encouraging that at least something is being done, especially here in Tennessee. Most of you know, if you're following me on my Facebook page, you know the situation in Tennessee is dire. And I do have a tendency to over-exaggerate or to exaggerate, but I am not in this case. The situation is dire in Tennessee because in Middle Tennessee, where I'm located, we only have one insurance company that we know of that will still be in the individual market for 2018, and that'll be Cigna. Humana has already announced that they will not participate in the marketplace for 2018, in the individual marketplace. And so that's dire. Now, in other parts of Tennessee, the pullout of Humana means that there is no insurance provider in those counties. And so I think that's pretty dire. And I know that this is happening in other states as well. And so that's the reason that this situation was pretty desperate. Also, something that people don't think about, they say, well, this is May and it's a long time until January of 2018. It is for you and I. However, there is not a lot of time for insurance companies to design their plans based on regulation and to market those plans, to do the background work that has to be done to get that ready, networking and all of that behind the scenes stuff that has to happen. And my understanding is the insurance companies have to let the government know by, I think it's the end of September, what they're going to do, what their plans are going to look like, and all of their plans have to go through government approval before the 1st of October so that those plans can be ready to go on the marketplace for open enrollment, which for this year, for 2018, will be November. It's very, very short, compressed open enrollment period this year going into 2018, which I am not happy about at all. But you can see my prior post and prior videos where I talk where I rant a little more in depth about open enrollment periods. But let's jump into what happened yesterday and kind of look at a few of the things. Earlier, when they first started talking about the Repeal and Replace plan, which they call America Healthcare Plan, I did a little personal review. I had looked at the comparison actually from Kaiser Family Foundation to kind of see what the good and the bad and the ugly were on what they were proposing. So they only changed a few things slightly, just a couple of modifications to that plan and the one that they passed yesterday. Also, kudos go out to Diane Black, who is my representative, who had a key role in presenting this plan to the House of Representatives. She is a registered nurse, and so it's a topic that's near and dear to her. Okay, so let's jump in. I've made myself some notes here, some things to talk about, so let's jump into that. First of all, let's look at some things that are remaining that are good. Now, they talk about repeal and replace, and I have said for a long time they can't repeal because you can't go back and unring the bell, which is true. So because of that, even though they call it a repeal and replace, it's more like they're tweaking the ACA. And so the bones of the ACA remain in the America's health plan. I think it's what it's called. Anyway, first of all, something that is a big hot topic that we hear on the news a lot of emotional response around this issue is pre-existing conditions. So pre-existing conditions remain. So for the most part, on this topic, it has become so politicized, which to me, it shouldn't be, because this is a very important issue, health insurance, health care, which we hadn't really got to the health care part in reform. It's just been health insurance reform at this point. But so the pre-existing conditions part, you hear a lot on the news. So don't believe everything that you hear or read or see, because people will, they like to give misinformation just to get people stirred up, or to so that people will agree with their point of view, which to me is, if you want someone to agree with your point of view, then you should present the facts and persuade them based on the facts as you see them, not based on things that are not true. But that's just me, maybe. So the pre-existing conditions will continue. In the insurance world, we call this guaranteed issue. So in other words, no one can be denied coverage. Now, there's a little caveat to this, and we'll see what the Senate does with it in their version and what it finally comes out to be. But one of the big issues, at least for insurance companies and at least from a financial standpoint, and one of the reasons that the premiums have become so high is because basically just sick people have been enrolling. And because there was no way to prevent them from enrolling, then a person who was sick was able to enroll. Now, you say, well, Wanda, that, of course they can, and that sounds terrible that you would say that they can't. Well, here's the problem with that. A lot of folks were coming and going out of the system. Now, it's one thing if you have an ongoing heart issue and you enroll in health insurance and you maintain your enrollment in health insurance and you have claims based on your heart condition, that's one thing. But you have maintained your enrollment, you've paid your premiums every month like a good person, a good citizen is supposed to do. And so you've paid your fair share. And so that is that's really the definition of insurance. You have paid your fair share. Maybe you're sicker than some of the other people, but you're paying your fair share. What has happened with around this whole pre-existing condition guaranteed issue, a piece of the ACA was that there was nothing to prevent people from being sick or being pregnant is a good illustration, because this having a pregnancy or knowing that you need some kind of surgery, it is sort of a time-based illness, if you will. So let's use the pregnant illustration because it works really well in this scenario. Is that let's say you know that you're pregnant at the time that you enroll in health insurance. So you know already you're going to have a big claim. You have your baby, let's say 4 months in to your coverage. You've paid 4 months of premiums. You have your baby. Now you're well again. You don't want to pay your premium anymore. Now, I know you're supposed to pay your premium, and if you don't, according to the ACA, you get a penalty. But for a lot of people, the penalty was no big deal, and so they would drop their health insurance. So for the rest of the year, they're not paying their premium. So they're not paying their fair share. They didn't pay the premium long enough to offset that big claim that they had. So the way that I read the new bill, or the way I interpret it, there may be something around that as far as if you don't enroll when you're supposed to enroll, and so during open enrollment, and you don't maintain your coverage. So that's kind of a big deal right there. And although it doesn't really say that your pre-existing wouldn't be covered, but it says they're guaranteed during open enrollment. So we'd have to have a little clarification on that. So that leads us into the individual mandates, which is the penalty portion of the ACA, and what was very distasteful to a lot of people is the government telling them, if you don't have health insurance, we're going to charge you a penalty, which the government called your shared responsibility payment, but it was an additional tax, and if you did not have coverage, then you had a penalty. So the individual mandates, according to the new bill, will be eliminated retroactively. So that would take it back where there wouldn't be penalties for lack of coverage in 2017. And the new bill assesses a late fee. So the way I understand this is, and it sort of ties in with what I was saying about the pre-existing condition clause, is that let's say that you were well, you didn't want to enroll in health insurance, and so you didn't enroll in health insurance, and you were given an opportunity during open enrollment, you didn't take it, you didn't do it, and then you went a certain number of months without health insurance. And then, the way I understand it, then open enrollment comes around again, and now you're pregnant, and so now you need health insurance again, and so now you're going to jump on. Well, now with the new bill, yes, you can jump on. There's no exclusion for pre-existing conditions. However, you can be assessed an additional fee. So, and that fee, and it's not really clear how that fee would be applied, whether that is a tax that would be assessed on your income tax, like the shared responsibility payment, or if that late fee would go to your insurance company to help offset what they know just about guaranteed will be claims. So not sure about that, but it's kind of a different take on that. Okay, so quickly let's move on to some of these other good things in the change in the law. The 10 essential benefits will remain. So again, if you hear people say it's not going to be as good or they're taking away coverage, no. The 10 essential benefits remain just like they were in the ACA. They will be phasing out the metal plans for 2020. Don't really know what that means. And a lot of the actuarials and all that kind of stuff, no one could understand that, I guess, unless you are a statistician or something. But the metal plans. So we'll kind of see what happens with that and the plan design going forward. A flat amount tax credit. Now, they're still calling it a tax credit, but instead of your tax credit being based on an arbitrary kind of calculation based on your age and your income, it would be a flat amount. So, based on your age, you may get $2,000 or $3,000 a year or something like that. But there is a cap with income. So if you're a higher income earner, you perhaps wouldn't get the flat amount to offset premiums at all. Okay, children up to the age of 26, that coverage continues. That's one of the things that was in the ACA, and that will continue. The big business mandate has been repealed. Now, this is the part of the ACA that said if you had over 100 employees, you had to provide health insurance. Or was it 50? See, now I'm confused. But anyway, one of the things that a lot of people felt was that, because remember there was a big discussion around what is full-time and the number of hours, and the government said full-time was 35 hours, not what we traditionally think of full-time as being 40 hours. So that meant that for companies who had more employees, and they fell under this mandate to provide health insurance, then everybody that worked at least 35 hours had to be provided health insurance. So guess what? That meant that they cut people's hours back so that they were considered part-time, not full-time. And this really hurt people because no longer were they earning what, traditionally we would call a full-time income. So they had to go out and get extra jobs, and it really hurt people, families. And so the big business mandate has been eliminated with this bill. Okay, so prohibition on the health rate. Okay, so this kind of goes back to the pre-existing thing. If you, one of the things that the ACA eliminated was being what we called upcharged for a health condition. So, prior to the ACA, if you were sick, if you had a pre-existing condition that was not serious, I mean, you weren't critically ill or terminally ill, but you had a chronic condition, then the insurance company would cover you, but they would charge you more for your chronic condition than someone who did not have a chronic condition. And we used to think, well, that's not very fair, but kind of now we're seeing, the results in the premiums when you don't do that. But so that continues. So there's a prohibition on charging more. So you still, with the new bill, you will not be charged because you have a chronic health condition, except if you do not have continuous coverage. So that kind of goes back to my illustration of, a person being pregnant and then all of a sudden wanting to have coverage and they're going to be charged more. So you could be charged more for a chronic condition if you did not get coverage when you first could have gotten coverage. So again, all the what that actually means, we don't know, but just another way. And these things, although they may not seem quite fair to people, it is a way to force people to do what's right. And so it may help the premiums for everybody else. The people that are following the rules, it may help the premiums for those folks. There is a new portion of this legislation which surrounds health savings accounts. And so if you are under 65 and you're in the individual market and you do not have a health savings account, by all means, if you have a high deductible plan, which practically everybody does now because they can't afford a silver plan, so they have a bronze plan. So if you have a bronze plan, you have a high deductible plan, go out and get yourself a health savings account. It's your money. You can keep it into retirement. I'm not an investment person, so ask somebody how it actually works. But you can put pre-tax dollars into it. You can pull out of that fund to pay for your health costs, like your, going to the doctor, going to the dentist, going to the eye doctor, eyeglasses, things like that. So what the new bill does is increase those contribution limits to health savings accounts, which I think is an excellent idea. Okay, so quickly, let's look at some things that are maybe not so good, or at least in my opinion. First of all, the federal marketplace will continue. I don't like that because I think it's discriminatory toward lower income folks who do not have access to the internet, or older Americans. So these would be folks under 65, but still older Americans who maybe don't know how to use the computer, or wouldn't know how to enroll online in anything. But the marketplace continues. And so we're stuck with healthcare.gov. Sorry. Open enrollment periods continue. Again, that's craziness, in my opinion. I'm not opposed to open enrollment periods, but I wish it were more of a rolling type thing, not all crammed into a little 6-week period right in the middle of Thanksgiving and right on top of Medicare open enrollment. You got everything going on during those 6 weeks in November. And so November, December, it's terrible. I hate it, but it's just the way it is. Another thing that could be a bad thing with the new legislation is the cost sharing reductions are being phased out. I think, I didn't write the date down, but I think it was 2019, I think. Anyway, the cost sharing reductions, most people don't even know what that is, but certain income levels were given a reduction in their deductibles and also their maximum out-of-pocket based on their income. And that was only provided to them on a silver level plan, which the government deemed was the best plan to have. Well, yes, we all agree. A silver plan with a $2,000 deductible is yummy. That Remember the old days when we thought a $2,000 deductible was horrible? Okay. So now a $6,000 deductible is horrible. And a $2,000 deductible is wonderful. So that's what a silver would be about a $2,000, $2,500 deductible. And so folks who were right now are lower income people, if in a certain percentage of the poverty level, would get something called a cost sharing reduction. So the government would share in paying their deductible and also reducing their maximum out of pocket for the year. So I've seen people that have, they may have been paying $25 a month for their health insurance and have a $500 deductible and a $500 max out of pocket. Fantastic. Maybe a little too generous. And, right now with what's going on and all the things, you got other people paying $6,000 in a deductible and they're paying $1,100 for that plan. Come on. So they're phasing that out. All right. Also, something that really kind of is near and dear to my heart is they're allowing the insurance companies to have higher age banding. Okay. So age banding means that the premiums are based on your age. Well, we all know we get sicker as we get older, not healthier. And so older people have more claims than younger people. It's just a fact of life. And older people do expect that their premiums are going to cost more than younger people. Now, the ACA only allowed the age banding to go up to 3 times as much. And so a person 62 years old would only be paying 3 times as much as a person 26 years old is paying. The new legislation allows the age banding to go up to 5 times as more. Oops. So let's just hope that some of the other measures will bring down premiums enough that it's not going to hit our seniors quite as much. Because, if I've talked to you lately, I've told you where we're really hurting folks right now in the current situation is between 55 and 64 is where people are really, they're paying the most premiums and they're having to select, bronze plans. And some people are going what we call naked, so no coverage at all, or go into a faith-based. And their health is not as good as it once was. And so, or there's more risk there. So, let's just see. Like I said before, this is all just preliminary. It's just the first step. But this is a good illustration. This first volley with the house is a good idea of kind of where their head's at, where they're thinking. I just hope that some of these changes are going to help us to get the premiums down and to open our markets up a little bit more so that there's more competition. So that you have more choice in your health insurance. And that's the key to it. In Tennessee, you have no choice. You have a bad network and you're paying a lot of money for it. And so let's just hope that some of these changes, if all of this goes through, will bring us more free market, which free market always brings the premiums down because when there's competition, people will find a way to get a lower price in there so they can get your business. And so that's where we want to be again. So happy Cinco de Mayo and First Friday of May. And I hope you've enjoyed this edition of First Friday. And so I'll see you next month, the first Friday of June. And who knows where we will be in this whole situation with healthcare reform. But until then, that's Wanda from Holt Health Insurance.